Hello everyone, welcome to my little video newsletter. Just want to ramble on about where we're at in healthcare at the moment and advice that I might have for my clients, my valued clients. What are we seeing at the moment? It's September 2020 in the midst of a coronavirus pandemic. It's been a very busy practice here. We are not seeing any hamstring tears or sports injuries, but we are dealing with a huge influx of back pain and neck pain, which relates to A, sitting way too much working from home, and B, loads and loads of stress. Okay, so I've ranted and raved about this before. You all need to move more. You all need to learn how to breathe properly because there's a lot of us are very stressed. I'd say 40% of people are extremely anxious for lots and lots of different reasons. 40% of people are probably ambivalent, going with the flow, and 20% just don't care. So really, I'd say 40% of people who are dealing with high levels of stress and anxiety is a huge increase in society, and it will have its manifestation over the coming months and years. So what are we going to deal with? Well, that's not good for you. Stress is not good for you. Anxiety is not good for you. You need to seek help. From a physiotherapist perspective, we would talk about the importance of exercise, getting outside, walking, cycling, running, doing some specific strength training and that sort of thing. If you've got anything specific in mind or if you have anything holding you back, that's where we come in. So if you need some help setting up a home-based program, give us a ring. We can certainly help. I want to get back to a more important point though, my belief, that is you are all staying away from the doctors. We are seeing a massive reduction in the number of people who are going to their GP for minor ailments or going to their GP for regular checkup. What's happening at the moment is there's a huge backlog of presentation for healthcare. So people who have serious underlying disease are going undiagnosed. People are not chasing up important healthcare needs. They are frightened to go to the GP, or even, I must say, the GP practices are almost scaring you off. There is telehealth, remember. You need to see your health professional regularly, okay? So let's push aside me, push aside physiotherapy. I want to talk about general health. There is a huge reduction in people doing diagnostic tests, doing their blood tests, getting those scans looked at. It's not just COVID-19, all right? If you look at the data, non-COVID-19 illnesses are going to harm more people, way more people than the pandemic itself. So the sequelae of this pandemic and the fear of seeking healthcare is driving a second pandemic, which is going to be a backlog of significantly misdiagnoses, poorly diagnosed illness and poorly managed because we're staying away, okay? Let's not even talk about the delay in elective surgery in all countries, but particularly Victoria. I mean, we're a little bit luckier here, outside of Melbourne, outside of Geelong, but I just want to get back to the importance. You must be checked up. You must adhere to your standard routine. And it's not just the GP, it's also the dentist, okay? Your teeth are important, and if you let your teeth go, there's serious consequences for your health. Not just, cavities and whatnot, but, infected tooth. That infection, that bacteria can get elsewhere in your body, so don't let things go. Make sure you look after yourself, you pick up the phone, you book that checkup with your GP and look after your health, okay? Don't delay, don't push it back because you never know. You might miss something important. So there's my rant. Let's all make sure that we do not ignore, and particularly you blokes, me included. I've got my cholesterol test. The GP gave it to me 12 months ago. I think it's out of date. I haven't done it yet. So I'm a hypocrite. I get it. But get checked out. Thank you.